Hi, my name is Jennifer Taylor, and today I would like to tell you about the community health promotion activity that I completed for Auburn University's School of Nursing in the RN to BSN program in the summer of 2021. I completed my project in the rural town of Abbeville, Alabama. I targeted the adult population and I educated people about stroke prevention tips and stroke warning signs, as well as the importance of time in seeking emergency medical help in the event of stroke symptoms. As I researched the Healthy People 2030 objective, this project became even more important to me in my mind. Their goal is to reduce the number of stroke deaths from 37.1 deaths per 100,000 that occurred in the year 2018 to 33.4 deaths per 100,000 by the target date of 2030. And they seek to do this by educating people regarding the prevention steps and warning signs of stroke in order to prevent death and disability. As I completed the windshield survey of my community, of course, I completed this in the town in which I live, and this picture I took here is a sidewalk that I commonly jog down when I have time. So I did notice that we do have plentiful green spaces, plenty of sidewalks for people to walk or exercise on. Looking at the community through this project was like looking through a fresh set of eyes, and it was very interesting to me to be able to discern and figure out what we do have in our community and what we don't have. But I did find that there are a lot of resources available for the people of our community. However, we are 30 minutes from the nearest hospital, so that's concerning as far as travel time to and from emergency medical services for conditions such as stroke. Upon my survey, I did note white, African American, and Hispanic populations were represented. There was plenty of activity at that time around schools and churches, which are primarily Southern Baptist or Methodist churches. We do tend to have access to fresh fruits and vegetables due to the outlying areas of Abbeville being farming communities. And evidence of obesity is noted and highly visible in the area. We do have $2 stores, 2 grocery stores, 2 doctor's offices, and 2 dentist offices. For some reason, 2 is the magic number. We also have a nursing home and a rehab facility available for citizens, as well as a mental health facility and a local health department in our county. I interviewed KB, who is an EMT with the Abbeville Fire and Rescue Department. She stated that there are concerns from citizens over the number of domestic violence cases, drug abuse cases, and the heart attack and stroke calls that are received by the service. She stated that a strength of the community is that community members look out for one another and call in for suspicious activity. She believes that residents need education on the stroke and heart attack, warning signs and symptoms, and other signs of serious illness, and that a lot of times people don't call in quickly enough. She stated that there are major concerns over the rates of obesity in the community and emphasized the fact that a lot of the calls come from elderly people for health conditions. We do have an aging population in our community. And that people need better access to transportation for doctor visits to and from, that we don't have a taxi service or public transportation, and a lot of times people use the ambulance service as transportation to and from locations. The community health nursing diagnoses that I formulated were: number 1 priority, readiness for enhanced health literacy concerning stroke prevention and the need for rapid treatment in adults in the community, related to lack of knowledge about strokes as evidenced by the frequency of strokes and delayed intervention in the community. Number 2, high risk for obesity-related health complications in adults in the Abbeville community related to high-fat diet consumption and lack of physical activity, as evidenced by high rates of obesity and physical inactivity in the community. And number 3, readiness for enhanced health literacy regarding blood pressure monitoring and medication compliance among adults in the community related to noncompliance, as evidenced by high rates of noncompliance and high rates of hypertension, which of course can lead to stroke as well. For the health data statistics of the community, I looked at the statistics for the entire county, Henry County, because there are not a lot of statistics for the city of Abbeville. So the surrounding county that Abbeville is housed in is Henry County, which has a population percentage 71.6% white people, 25.9% black, and 2.7% Hispanic, and that African American population is greater than the U.S. percentage of 13.4%. And that's important for a later statistic, but we do have a higher than average population of African American people in the county. The Alabama life expectancy is 75.1 years of age versus the 78.7 years of age U.S. average. So we do have a lower life expectancy in Alabama. And stroke is the 4th leading cause of death in Alabamians, which was a very alarming statistic to me. As I went on to review the scholarly literature, I found a 2017 study of stroke patients which showed that African Americans are 2 to 5 times more likely to experience stroke than are white Americans. And they often have strokes at younger ages as well. And a lot of this, the article implied that it had to do with the lack of control of some health conditions such as diabetes, high blood pressure control. So that's definitely a disparity or a serious problem there, that African Americans are more prone to have strokes. And a 2016 article I found stated that time is an important factor in preserving brain function to prevent death and disability and impairment in people post-stroke. And it was citing the need for quick telehealth visits to ensure fast and proper treatment so you could reverse the damage that stroke causes or limit the damage. So of course that's very important for our area as well, since we have limited transportation and ambulance service, and it does take a while to get to the nearest hospital or stroke center. I reviewed the American Stroke Association recommendations. They recommend a low-fat diet and keeping obesity at bay. They recommend 150 minutes of moderate exercise per week, maintaining a healthy blood pressure, not smoking or stopping smoking, regular doctor checkups, so keeping your doctor visits, and knowing the warning signs of a stroke, which on the right you can see on that PDF the acronym FAST that they put out for the public. Spot a stroke fast. F stands for facial drooping, A stands for arm weakness, S stands for speech difficulty, and T stands for time. Of course, time to call 911 and get emergency medical treatment as quickly as possible in the event that stroke symptoms are obvious. And this education is one thing that we did give to people when we implemented our education. So my intervention plan was to educate adults at the Abbeville Farmers Market. And I chose this location because it was one of the few events that were happening in Abbeville this summer, and I knew that a lot of people would be there to buy fresh fruits and vegetables. So my plan was to educate people regarding stroke prevention steps and warning signs, and the importance of time as a factor in getting treatment as quickly as possible. I plan to evaluate knowledge and learning pre and post education with a typed evaluation that I had them fill out. It was just some basic questions, multiple choice questions regarding the FAST acronym, the numbers for a healthy blood pressure, some warning signs of stroke, and some prevention steps for stroke. And we had them fill that out pre and post education to assess for learning. And I plan to utilize the current literature from the American Stroke Association, the CDC, the Department of Health and Human Services, and I plan to offer blood pressure checks to people that wanted to participate, or whoever was walking by if they wanted their blood pressure checked. We did that. And then, of course, like I said, we emphasize time as important in seeking medical treatment. So on the intervention day, we set up a table at the Abbeville Farmers Market on June 24th on a Thursday afternoon. 11 adults were eventually educated that walked up, that asked to participate or were willing to participate, and they filled out the written evaluations, which showed evidence of understanding and retention. Pre and then the post, of course, showed evidence that they had learned. Participants were able to verbalize to us the ways to prevent stroke, the warning signs of stroke, and the importance of time after this intervention. Copies of stroke education were given, and I'll show you what I gave them in a minute. And I did give them reminder prizes from the American Stroke Association for home use. One of those was a magnet that shows the FAST acronym that you can put on your refrigerator. And the other was a pen that clicks, and you can see the elements of the FAST acronym every time you click the pen. My preceptor also brought the blood pressure cuffs, and we checked blood pressures. And that handsome guy there on the right is my 16-year-old son. He showed up and he just wanted his blood pressure checked, so we did that for him. And the other picture is a sweet lady from the community that I'm talking to about stroke prevention and warning signs. And my preceptor also brought some tubes that show typical fat and sugar content of various foods. And she also brought a model of a clogged versus a clear artery to show what a clogged artery may look like. All of these participants seemed to be very receptive and very thankful for what we told them, and evidence of learning was there. And we gave these home reminders to reinforce learning. On the left was one about physical activity and the amount of exercise you should get, what constitutes moderate exercise. And then in the middle, the FAST acronym from the American Stroke Association. We passed that out to people, as well as the one on the right from the CDC about stroke. It was a little more in-depth about what causes stroke, and then again the FAST acronym and the warning signs and that kind of thing. So for the future, I feel like our intervention was very successful, but with more time, more resources, a greater audience, without the constraints of a semester, I feel like more people could be educated in the community regarding stroke. We could use billboards, radio, TV ads, newspaper ads, social media, any other kind of events where people are present in the town. I feel like we could get more education done, or get the word out and get more people exposed to the information. The importance of stroke prevention and health promotion of a community is a worthy cause, very crucial to the well-being of the population, to families, and our communities need us. And I did realize this throughout this activity, that we have a wonderful privilege as nurses to make the impact that only nurses can. So in conclusion, the most alarming statistic here to me was that stroke is the fourth leading cause of death in Alabamians, and not just death, but disability as well. The community of Abbeville is at risk for obesity, hypertension, and stroke, leading to death and disability. Community health education regarding the prevention methods of stroke and the warning signs of stroke was implemented at the Abbeville Farmers Market in downtown Abbeville, and 11 participants were educated, and they showed evidence of learning and retention, both on their evaluations and just verbally telling me that they understood. And this intervention was eye-opening to me, truly. It was a great experience, and I realized, or maybe it was re-emphasized to me, the importance of prevention in nursing and the impact we can make because we have the tools. we have the information and we have the ability to educate people and impact lives, and that's a very important part of nursing. And I greatly enjoyed this activity. I appreciate the opportunity, and I thank you very much for listening.